Salam Sejahtera and welcome to this special forum on COVID-19 vaccination. It's a special forum for Christian leaders. My name is Dr. Yap Wei An and I'm part of the Selangor Taskforce for COVID-19. And I would firstly like to thank our co-conveners, the Archdiocese of Kuala Lumpur and the Council of Churches Malaysia. We have registrations from across the country and across the denominational spectrum. We have Roman Catholics, we have even someone from the Russian Orthodox Church, SIB, Methodist, Anglican, Evangelical, Brethren, Independent, and so many others. This is truly an ecumenical event, highlighting the concern and importance placed on COVID-19 vaccination by the Christian community. And I just want to thank everyone for your presence here today. Just to let you know, this session is being recorded for the benefit of others. And I would firstly like to just remind everybody that as you come in, please mute yourself so that it'll be easier for everyone else in terms of hearing. Now, as it's a forum, we would like to use Slido for questions, and the hashtag for that is #jabs. We have already received many questions through the Google Forms circulated earlier, and we will prioritize those questions which have been sent in advance. And I would like to thank all those who have already sent your questions. It's really helpful. As a quick icebreaker, I would like to invite you all now to go to Slido by scanning the QR code here or by using Jabs. And we will also put a link in the chat. And please, when you go to Slido, look at polls and answer the first question. Where are you calling from? Just as we wait for everyone else to come in.
No sound yet. Mine already mute the entry, the mine is automatic.
Yeah, just a reminder to everyone who has just joined us, please mute yourself on entry. And while we wait for everyone to come, please start us off by going to slido.com, either scanning the QR code or use the hashtag jabs and answer the first poll. Where are you calling from? Well, we have somebody from outside the country, someone from Brunei. That's excellent. Welcome. I know most people are from KL, but I see very strong representation from East Malaysia as well, from Kota Kinabalu, from Sarawak. And if you're someone from Singapore as well, that's excellent. Welcome. From north Alostar to the south Johor Bahru, that's great. For those who have just joined, just a friendly reminder, please go to Slido and just join us by answering the first poll, which is where are you calling from? You can either scan the QR code or use the hashtag jabs. When I was looking at the registration data, I realized that we had people from Lundu to Likas, from Papar to Prai, Kluang to Kuala Lipis, Sungai Petani to Subang Jaya, Taiping to Tawau.
And it is a pleasure to.
Right. Can I just ask everyone just to mute yourself on entry if that's okay? Thank you very much. And also ask my able assistant to help to mute those. Welcome everybody and thank you. And just a reminder, this is a forum, so you can continue to use Slido. There'll be a second poll question, which is on to submit questions after this poll, and feel free to use that as well to submit questions at any time. Yes. Okay, let me move on to introductions. I'm going to share my screen if you don't mind. So welcome everybody once again. I know there are so many online forums on COVID-19 vaccination, and I just want to thank you for joining this one. What makes this forum different is that it's primarily for Christian leaders, although all are welcome. And the focus is actually on how to empower Christian leaders like yourselves to engage with your congregations on COVID-19 vaccination, how to communicate risk in an informed manner, and how to lead by example. And for this, we have an expert lineup of panelists. May I request everyone to mute yourself on entry? For this, we have an expert lineup of panelists representing not only medical experts, but also ethicists and theologians. Allow me to introduce our guests first, and I'll do so in alphabetical order, starting with Professor Dato Dr. Adeeba Kamaruzaman, who is a graduate of Monash University and trained in internal medicine and infectious diseases in Melbourne. She came back to Malaysia and established the infectious disease unit at the University of Malaya Medical Center, where she is now professor of medicine and infectious diseases. As one of the foremost global experts on HIV and AIDS, Prof. Adeeba is currently serving as the president of the International AIDS Society. Next, we have Associate Professor Dr. Alex Tang, who's a senior consultant pediatrician at KPJ Johor Specialist Hospital in Johor Bahru. He's also Associate Professor of Pediatrics at the Clinical School of Monash University and is a founder and director of Kairos Spiritual Formation Ministries. He is a preacher, a speaker, social technocrat, and author of several books, including on bioethics, and is currently faculty at the Asia Graduate School of Theology Alliance, Seminary Theology Malaysia, and the East Asia School of Theology in Singapore. We also have Reverend Father Dr. Clarence Devadass, who is a Roman Catholic priest and the director of the Catholic Research Center. He has got a doctorate in sacred theology from Academia Alfonsiana, Rome, with a specialization in moral theology. He continues to teach on, among other topics, Catholic bioethics, and is a lecturer at various global institutions. We also have Dr. Yuho Horikoshi, who has just come to Malaysia. Welcome, just a special welcome for you since you're new to Malaysia. He's a pediatric infectious disease physician, and he founded the Division of Infectious Diseases at the Tokyo Metropolitan Children's Medical Center. He trained in Canada and is widely published in peer-reviewed journals and has been involved in research and clinical trials. More recently, he's joined WHO through the Stop Transmission of Polio program and was deployed to Nigeria to support polio eradication efforts before his current assignment to Malaysia, which began sometime a few months ago as the Immunization Technical Officer covering COVID-19 and other vaccines and diagnostics. Now, I just wanted to start off with a few intro questions just for everybody to get to know all of y'all. And Dr. Yuho, if I might, I would like to start with you. I know you've recently started work in Malaysia, having spent many years in on immunizations in communities in northern Nigeria, in, I guess, the Sahel region. What one strategy have you found to be most useful in persuading those who are hesitant to accept vaccines?
Okay.
Go ahead, Dr. Yuho.
Yep. Thank you for your kind introduction, Wei-An. So I think vaccine hesitancy is a now global issue. It is now WHO actually listed as one of the top 10 health threats. And so first of all, you need to look into the cause of hesitancy. So it is very complex and also need to see in the social, cultural, historical, even political context. Then you need to deliver the correct message through the correct channels. So when I was in Nigeria, unfortunately, the government there was not so much trusted. So what government says, people don't trust. So you have to find somebody very trusting by the local. So those are leaders are usually religious leaders or traditional leaders. So we deliver the message to them, and then those the health important message was delivered by them. So I think correct information to the trusted people are very key to tackle the vaccine hesitancy.
Thank you so much, Dr. Yuho, and I'm sure we'll be looking forward to hearing additional insights from you. Father Clarence, as a priest, as a moral theologian, you have been in the front row seat to observe the impact of COVID-19 on households, especially those who are marginalized. Could you share with us just some brief observations on COVID-19 and social justice?
Thanks. Good evening, everyone. As you say about the marginalized, I think one thing that COVID-19 has shown is that it has impacted all of us, whether you are marginalized or you are not marginalized. All of us have been impacted. All our lives have been disrupted. I like to use the little image of Pope Francis, who used these words by saying that we are all in the same boat. So in the boat, that whether you're a captain or whether you are in the engine room or whether you are in the restaurant, we're all in the same boat. And if we sing, we all sing together. And I think the reality is that what this pandemic has shown is that humanity, that wherever you are, whoever you may be, that we are equally vulnerable in the situation of a pandemic. And I think those who are marginalized, they have a kind of they're starting off from a disadvantaged position. And not necessarily those who are economically poor. I think everyone has been impacted in some way. If you are not financially impacted, I think emotionally people are impacted. Psychologically, people are impacted also with the lockdowns that we have had. And I think one of the things that we have seen is that, in terms of people, one thing I realized that, humanity, we are quite resilient in many ways. When confronted with such a challenge, people are able to rise up and to help one another. I think Malaysia has had a kind of a campaign called Kita Jaga Kita, we look after one another. And it kind of shows that, when you are pushed to a corner, people can rise up and look after each other very well. And I think that's a very basic principle of social justice, that everyone looks at each other as a brother or a sister, having to help, having a need for some kind of an assistance. So I think the reality on the ground is very real, in the sense that everyone is impacted in some way. You cannot say that not one person has been exempt from being impacted by this pandemic. In terms of, I think, social justice in this area, it's hard to talk a little bit about during the pandemic. But I think in a recovery period, I think there are many groups that are vulnerable who need assistance, who need to be looked into. So I'm not just advocating, kind of an equal kind of an assistance, but maybe an equitable kind of an assistance for people who need more. There are some groups who need more assistance than other groups. And I think this is something that, policy makers, those who are making decisions have to take into account. So I think the reality is that we all are impacted, and it goes beyond the principles of justice, of the situation that we are in. And I think what it has shown is that we can rise. Humanity can rise when you put aside all our differences and put aside all our biases that we carry. We can rise up to respond to a challenge like this. And I think this is something that we look forward, when we come out of this pandemic, that we don't retreat back into our caves, but rather we move forward in the sense that, to see each other as people journeying together. Yeah, so those are just some introductory comments.
Thank you so much. And I'm really also interested to hear about intersections of COVID-19 vaccination and equity. Dr. Alex Tang, you trained both as a consultant pediatrician and also in spiritual formation. Could you share some of your reflections on COVID-19 pandemic, both as a doctor and as a spiritual director?
I think the pandemic hit us very badly, in the sense that in a way it took us by surprise. So as a practicing clinician, we basically closed down everything. Well, literally closed down, but the hospital still runs. Okay, so we have to rethink our way of the delivery of healthcare services. So that is a big challenge. Then as a theological and a medical educator, we basically move online. So that is another challenge, because we have to rethink how do we teach online. And then as a spiritual director and as a church-based ministry, we also move online because of lockdown. So again, I think this is a good time, very interesting time for us to reflect, how do we be church and what are the essential components of being a church. Yeah, thank you.
Excellent. Even this forum has moved online. That's a very excellent observation. Prof. Adeeba, I know you've dedicated your career to addressing infectious diseases, and in recognition of that, you're now elected as the president of the International AIDS Society. Thank you very much for joining us. With each infectious disease, I realize one meets a different community. So with HIV and with AIDS, one has to engage with intravenous drug abusers and the MSM community, marginalized people as well. For COVID-19, what new community, if you like, have you become more acquainted with in the context of this pandemic? And what insights have you gleaned?
Thanks very much, Rian, for inviting me to this afternoon's discussion. Well, I think with HIV, of course, what we learned from it was in order to adequately address it, we had to not leave anyone behind. The mantra of HIV, that's also the mantra of the SDGs. As you mentioned, when working with HIV, I encounter the LGBT communities, the people who use drugs, and as a result of that, prisoners as well. And there are overlapping groups and populations that are at risk of both HIV and COVID-19. And prisoners are obviously at huge risk, and we're seeing lots and lots of clusters in Malaysia and around the world, resulting in thousands of infections, if not many deaths globally from the business setting. But a new group that I have not, I guess, been very much engaged with in HIV, but have had to learn much more about would be the migrant workers and the refugees, both documented migrant workers as well as undocumented. Although unlike in HIV, I've been involved on the ground with these marginalized groups. I have to say, with COVID-19, with the exception of prison, with migrant workers like you, have been more involved at the policy level rather than being hands-on at the ground level. But nevertheless, that's one new group that I think I've been exposed to, or two, yep. I would say, the refugee and yes. The migrant population.
And we hope they will be vaccinated too. Thank you so much.
We hope so too, yes. As soon as possible, yeah.
Let me just very quickly run through the agenda, which is we'll go through the forum right now. And I've divided the questions that we received into 4 categories: about safety, efficacy and durability, eligibility and choice, and then ethical and theological considerations. So that's roughly the structure of how we're going to go about. And then we'll have Dr. Yuho tell us about how to communicate risk, and then we'll have His Grace, the Most Reverend Archbishop Julian Lau, to close us in prayer. So that's the agenda for this afternoon, and I'm going to go straight to our questions. And we had a lot of questions about safety. Adakah vaksin yang diberikan selamat? Is it safe? And I'm sure most of our panelists will watch and for what is known about its safety parameters. But what I would like our panelists to weigh upon for this particular audience is to tell us how can church leaders provide informed and persuasive answers to their congregants on COVID-19 vaccine safety, on side effects, which was a question asked by someone from DUMC, and about adverse effects, which was a question asked by someone from LICAS. What is known and what is now not known? How do we communicate risk and uncertainty effectively to our congregants? And indeed, how do we even compare the risk of vaccination with the risks of the disease itself? May I call upon Prof. Adeeba, if you don't mind, and others can weigh in. How should we explain vaccine safety and to the general masses?
Thanks, Rian. And I think we need to explain it with facts, obviously, in as transparent a manner as possible, and in language that is easily understandable. Now, first of all, in terms of facts, I think there's a lot of fake news and misinformation that's traveling around on WhatsApp and social media. So it's essential that we translate this into, or we communicate the facts of the matter, and not try and hide or minimize the side effects that do occur. And I think what is confusing is also because there are many different types of vaccines, many different, technology. And so separating the different side effects is also important. For instance, the early and immediate side effect, pain, and that has to be clearly explained. This is common when you get an injection and you get a vaccine, that there's going to be some local pain. And then at the extreme, you've got the anaphylactic reactions, the severe allergic reaction where patients or vaccinees may experience swelling and difficulty breathing. So that tends to occur more with the mRNA-based vaccine. So, we need to explain that in terms of what it is and how commonly it occurs, and who's likely or not likely to have that kind of reaction. So I think that would be the best approach. I know there's been the publication from the UK government that's also been circulated around saying, oh my God, there's been like 20,000 side effects. It's also important to communicate with the public that with clinical trials, every single side effect needs to be reported, whether it's a little itch in a tiny little toe or a severe adverse event.
Right.
And these then gets recorded, and unfortunately, unscrupulous people tend to take it out of context. Similarly to the publication from the UK government, who have this post-vaccination pharmacovigilance. And, if you look at that publication, it says, I can't remember the numbers, but under cardiovascular complications, because someone complains or reports increased heart rate, that gets included, and then say, oh my God, there's, like 12,000 cardiovascular complications. I can't remember the exact numbers. So it's very important that all these numbers and facts get put into the right context. But at the same time, we have to be responsible and communicate the facts of the matter. Yeah.
Thank you. I think this is such an important question because so many people asked it. So I would like to ask all the other panelists also to weigh in. Dr. Alex, would you like to add anything
No,
or highlight anything?
I agree totally with Prof. Adeeba. I think this is a very important question and need to be addressed. Okay, we cannot sweep it and say, oh, yeah, just trust us. We tell you so. We told you so. Okay, and foremost is information and education. Okay, that means we need to the professionals and need to give the public the correct information, and as leaders, you need to receive the information and then pass it to your people. I think that's very important, that we should have some level of filtering to see which are the correct information and which are not. So don't automatically pass on what you receive in your WhatsApp. Okay, because I think people just automatically forward because it's so easy. Okay. And I always like to say that, yeah, I mean, there are side effects, but everybody is watching. And to date, we have about 300 million doses given. So this is the largest single experiment of vaccine surveillance in the history of mankind. Okay,
Wow.
so you cannot hide. Okay, you cannot hide facts. And the fact is that 300 million doses has been given, and it's been safe so far. Okay, so that's the message I will convey.
And Anything to add, Dr. Yuho, on how to communicate risk? I think,
Yes,
go ahead.
so I think I totally agree with Dr. Adeeba and Dr. Alex Tam. So the WHO is very much keen on monitoring these safety issues, and we try to update the information regarding COVID-19 vaccines, because there's so many misinformation is out there, especially on the social media, and some of them are just created by the anti-vaxxers, and
Right.
those are totally, unreliable information. So one thing I would like to highlight is please refer to the trusted source of
Okay.
information. That's I think most important resource to get about the safety on the COVID-19 vaccines.
Thank you. I think that's really good advice. Information and really trusted sources is what I'm hearing from you all, and telling people the truth. I think that's good. And 300 million doses given, and very hard to hide if there's something really wrong with it. Careful about your WhatsApp messages. Thank you so much. Now, some people have pushed back on this question, and they've said, but vaccines were developed and tested in record time, less than a year, compared with several years for most other vaccines. Surely some shortcuts have been taken. Where did you compromise on safety? Why do you get it done so quickly? Come out with the truth. Have clinical trials even been completed for these vaccines approved for emergency use? These are some of the questions I've got. It's a compilation of questions. Thank you, Nicole from Kingdom City, for some of these questions. Anyone wants to try to address this? How about Alex? Do you want to go first?
Well, I think this is a very excellent question, and can we trust a vaccine that's produced, say, in 9 months? Okay, which, considering the normal vaccine that we have been using, usually it takes about 2 to 3 years for the lab trials. Then in phase 1 trial, which is about 1 to 10%, is more for the dosage. That will take about 1 to 3 years. And then phase 2 is about 10 to 100%. Then we just see whether the vaccine works or not. And then phase 3, which is a bigger one, to about 1,000 to 10,000. Okay, and that will take 1 to 3 years, and then 1 to 3 years for FDA approval, and then the production within 1 to 3 years. So basically, vaccine comes out in about 10 to 15 years. Okay, that is what we have been used to, and most of our vaccine takes about 10 to 15 years. Okay, so I wanted to address that the 9 months vaccine, the super fast vaccine. Okay, 3 factors I just want to highlight. First is that the technology has improved. Okay, I mean, we don't question using our high-tech smartphone nowadays, because that is actually have more computing power than the whole of the Apollo project. Okay, but I think technology has improved the production of vaccine. Okay, we say that, the new RNA vaccine is new technology. Actually, it's not that new. Okay, it's about 20 years old. It started about in the year 2000, when the human genome was sequenced. And now we're talking about genomic medicine now. And then in the intervening years, we already have the technology to sequence or to actually write the code, the genetic code. So we have CRISPR. It's actually like writing a software. So we can actually edit and insert amino acids and all that. So that is already in place. And then in 2003, okay, 2002 to 2004, when we have the SARS, that was a big wake-up call for us. Okay, so it wasn't that bad in the world, but then about 7,000 infection, about 7,000 infection, about 700 deaths. Okay, so since the SARS, we have been preparing for the next pandemic, another corona. So since the SARS, we have MERS, we have H1N1, we have Ebola. Okay, but actually, what we prepare, the SARS help us to prepare the protocol, what to do in case another. So in actual fact, what we are doing for COVID is actually prepared in the SARS time. Okay, so that is one. The technology is improved. Okay, so we are actually ready. And this is this is an interesting fact that when the in January 2020, okay, you find that they begin in China. Okay, in Wuhan, they begin to discover that okay, there is a potential pandemic level. Okay, and they discover this SARS-CoV-2. They actually sequence the genome of the SARS-CoV-2, and then what is very good is that the Chinese scientists put it online free. Okay, they didn't say you must pay and patent it. Put it online free about 18th of January. Okay, 2 weeks later, the couple who runs the BioNTech actually sequenced the vaccine. Already 2 weeks in January 2020, the vaccine is ready.
Amazing.
Okay, only thing they don't know how to manufacture it, so they team up with Pfizer. That's why now we hear Pfizer, BioNTech, because Pfizer is the one who produce vaccine. So that is the technology. Okay, actually the enzyme is ready. It's just how to produce it and test it. So that's one. The second one is that you need the funding. Okay, whatever you think of President Trump, okay, or former President Trump, he started Operation Warp Speed, which put $1.6 billion into research for COVID. Okay, vaccine. Okay, normally vaccine depends on funding, vaccine research. No funding. That's why Ebola vaccine takes so long, 10 years to develop, because no funding. Right?
Yeah.
We have $1.6 billion. So everybody jumps onto the bandwagon. Everybody gets funding. There's so much money, they don't know what to do with it. So research goes forward.
Yep.
Okay. And then phase 1, phase 2, phase 3. Okay, when you're doing phase 3 trial, which is the human trial, last time they only can manage about 5,000 people. Now they're doing 60,000, 70,000 people for phase 3 trials. And to get enough vaccine, they have to build factories. So that means they're already building factories for the vaccine even before the phase 3 trials is over.
And that's sped it up. That's really good.
So by the time the phase 3 trial results are out, most of them are out in middle June or to November 2020. The factory is already. So that's how the vaccine comes about. Okay, phase 1, phase 2, phase 3, there were no shortcut taken. Okay, all of them have been published. Phase 3 results have been published in recognized peer-reviewed journal.
Yeah.
Okay, like New England Journal of Medicine, Lancet. Okay, by the end of 2020, all of them has been published. Okay, while they are still making the vaccine thing.
Right.
So WHO, I think, Yuho can tell us that WHO has all the data. And then subsequently, before each country approve the vaccine, the country have their own authority board or regulatory body, which will go through all the data again.
Yeah.
So I don't think it's
no shortcuts.
No shortcuts. Okay, I don't think there is any shortcut in the thing. It's just that because of the new technology, because of the pandemic situation, that we sort of get the vaccine fast.
Okay.
Sorry for the long answers.
No, but I think safety is very critical. And Dr. Yuho, I think you want to respond as well. Can I do it this way in the interest of time? Let me pose the 2 other questions on vaccine safety first, and then we can circle back if there are additional remarks on vaccine safety. So we have questions about the long-term risks. Do we know whether it's safe? Does it affect fertility? Does it cause autoimmune diseases? Various people have asked this and they've chosen to be anonymous. That's one question which I'd like to pose perhaps to Prof. Adeeba, if you don't mind. And then after that, I would like to pose a question to Dr. Yuho, which is, if it's really safe, why are pharmaceutical companies waiving liability, and why do we have to sign a form? Questions like this were asked by, for example, Peter at PJ Gospel Hall, among other people who chose to remain anonymous. So if you don't mind, long-term risk, Prof. Adeeba, and then why waive liability if it's really safe, right? And then I'll just circle back and see if anybody has additional remarks to make on this overall issue of vaccine safety. Over to you, Prof. Adeeba.
Yeah, so I think specifically on the issue of fertility or infertility, as the case may be, I think that came from a letter that was, or this whole issue cropped up because of a letter that was sent to the European Medicine Agency, the EMA, and which is the equivalent of the US FDA, by two well-known anti-vaccine conspiracies. And what they claimed was that the vaccine contains a spike protein called the syncytin-1, which is vital for human placenta in women. And that's how that whole issue of vaccine causing infertility came about. In actual fact, yeah, of course, syncytin-1 is vital for the human placenta, but there is nothing in the COVID vaccine that contains this particular protein, and so it's made up false news in essence. In terms of causing autoimmune disease, of course, the way vaccines work is to induce your own immune response, antibodies, as well as the T-cell response. But, from what we've known of, and this is not the first vaccine to be used, right? We are all vaccinated, hopefully, with the MMR vaccine, the hepatitis vaccine, etc., etc. And there's been no, sort of correlation between vaccination and the development of autoimmune disease subsequently. And there's no reason, again, to believe that this vaccine is going to be any different.
Thank you. Over to you, Dr. Yuho, on liability.
Yes, so for the pharmaceutical liability, it's a very good question. So actually, it is not the issue with the safety. It is just more like a legal framework of the COVID-19 vaccines used in the context of the global pandemic. So if we wait for the full licensure for new vaccines, as Dr. Alex Tang mentioned, it would take years. So waiting for the years, millions of people would die. So we want this happen so that most of the government authorize the vaccine with conditional approval or emergency approval. So in this context, the pharmaceutical companies actually it's not responsible for the liability issue. It's a government responsibility. So actually, it's just a question of whether government or vaccine company will take a responsibility. And in this conditional use or emergency use, usually the government is responsible. And I think Malaysian government, last week announced that the compensation policy for the severe adverse event following immunization, if you had any serious adverse event after the immunization, you will be compensated by the government. So I think it's just a matter of the system. It's not a safety issue. Okay,
understand. Yeah. Now, before we move away from the safety questions, I just wanted to open it up more broadly. If you yourself or Dr. Alex or Prof. Adeeba, if you all have any other comments on safety and how to communicate that.
Well, I can share my personal experience.
Okay.
So
yeah,
I'm probably,
please do.
I don't know, of this group, I'm probably the, sorry, I put on my video. I'm probably the one who's received both vaccines. Only one, I don't know about the rest of you. And like I said, it's important to be truthful. And so it was not without zero side effects. So with the first dose of vaccine, I felt tired. and some local pain. You feel a bit achy in the site of injection, which went away after about 24, 48 hours. The second dose, which I just received last Monday, the same thing, some local achiness. And precisely 12 hours after the injection, I started developing chills and fever, and very, very fatigued. And a lot of my colleagues who have been injected the second time the same way, it felt the same way. And, I had chills, I had a bit of fever, and, after 48 hours, all that just turned off like nothing ever happened. And, I've been joking with my friends saying that I know that I have a robust immune system,
right,
and hopefully I'm one of the 90%ers. So yes, there are side effects, and it's not, it feels like you've had the real flu kind of thing.
yes.
Yeah, and I think it's important that those of us who've been vaccinated share these experiences in the sense that, sure, you do get side effects, and some people may get it worse than others.
Yeah.
I
Go ahead.
received mine last Tuesday, the first dose. So, in fact, surprisingly, I was expecting fever and chills and pain, but I didn't get any of it. So I was just checking whether I actually received the vaccine or not.
Yes, I know some people who are very relieved to get side effects, especially medical people, because then they knew they got something which was real, and
Yeah.
including myself. Now,
So I think the experience varies from person to person. Yeah.
yes, that's very true. Thanks so much for these honest answers. I think that's really good. And in fact, some people in the survey just said that it's really good if people who have been vaccinated give some testimonies of the sort. So I think that's good. I want to also ask a question eventually to Father Clarence even on this issue. And let me explain the situation. It's not going to be to you first, but when we weigh risk, we have the risk of the vaccine, but we also have the risk of not taking the vaccine. In other words, the risk of getting COVID-19. Many people have asked the questions, right? They've said like the case fatality rate is very low. There are other treatments, there's even ivermectin, and all these things. How do we really need this vaccine? How do we know the existence of this virus? Has it really been proven? Why can't we just treat it with ivermectin and spare everyone the supposed risk of the vaccine? So I just want to pose these questions to any of you, either Yuho or Dr. Alex or Prof. Adeeba. Like, do we really need it? I mean, is COVID really that bad? And to Father Clarence after that, I want to ask you, is there even a Christian mandate to participate in vaccination? So, but let's ask the question, is it really needed? Do we really need it?
Maybe
Capital
maybe
letters
I
was
can
how the
take
question
this.
came to me.
Maybe I can take this as someone who manages patients with COVID-19. Yes, the case fatality rate is low compared to many other diseases, but the risk of getting first of all, the risk of getting infected is real. We still have reasonably significant community transmission going on in Malaysia, and because of the ease by which COVID-19 can spread, any one of us can be at risk of getting infection, right? So that's number one. And number two, yes, 60% or so of people will get either asymptomatic or very mild disease. But if you happen to belong to those who will get moderate to severe disease, then it's not a very nice thing to have, because it causes pneumonia, and it can cause severe pneumonia, and all you need to qualify as those at risk of getting severe disease is number one, the male sex, right? Number two, if you happen to be over 60, that already puts you over that edge of getting severe disease. Number three, if you have diabetes, obesity, heart disease, etc., etc. So in Malaysia, there's a significant number of people who belong to either one or more of those groups that put you at risk. yes, we now have good treatment. It's not called ivermectin. It's called dexamethasone or tocilizumab, which have been proven in large clinical trials to be effective. But the point at which we give you those drugs is when you get very sick. Now, we have seen a number of cases where you may seem very well, and then suddenly, you deteriorate. And, once the disease escalates, even in the best of hands, you may not survive. So why would you want to take that risk when, there is something that is 90% or more effective at reducing you from getting severe disease and dying from it? So that's number one in terms of that whole morbidity, mortality story. Number two, in terms of why you should be vaccinated, even if you don't get severe disease, but you do get COVID-19, we know that a proportion of people, we don't know exactly what the percentage is yet. Some people say it's 5%, some people say it's higher, of you getting long-term disease. Now, there was a story in the New York Times yesterday or the day before of a man who committed suicide because of long COVID. He had this severe tinnitus in his ears that presumably he couldn't stand it anymore and chose to end his life. Now, and I just saw someone in clinic today who had severe COVID. Yes, she survived, but she is so fatigued from it that she can't even walk from one end of the room to another. So, do you want to have all these things when we have a powerful tool to prevent it?
Time is tight. I would like to move us on swiftly. And this brings us to the next section, which is on efficacy and durability. And I see that there's a question already by David Wong. Do we need to take the vaccine yearly to stay protected? And indeed, we had a lot of advanced questions on similar theme to this. Now, I would like to pose all three questions to Dr. Yuho for this section. How effective is the vaccine? And I think you can divide it into hospitalization, severe disease, etc. Particularly, how effective is it in preventing transmission? And therefore, what can we do, after we've been vaccinated? And how long will I remain protected once I'm vaccinated? Dr. Yuho, if you'd like to take all these three questions, and then I want to move on to some of the more controversial questions where it's really helpful to have a panel.
Okay, so actually the clinical trial for the vaccines, they usually just evaluate the symptomatic COVID-19 infection, which means that you had a SARS-CoV-2 virus, and if you're having fever, coughing, so they are just evaluating these symptoms. If you want to evaluate severe disease or death, you need a very large participant in the clinical trial, which is virtually impossible. You have to recruit hundreds of thousands of people. Most of the clinical trials usually maybe up to 60,000. So in this the size of the clinical trials, you can only evaluate the symptomatic COVID-19 disease. So the data so far we have is we know that we can prevent the symptomatic COVID-19. So it probably will also prevent severe disease and death, because if you had a fever and coughing, and then next probably you will develop pneumonia, and eventually in the worst scenario you might end up dying. So that the prevention of COVID-19, symptomatic COVID-19, is kind of a surrogate for the evaluation of the effectiveness of the vaccine. So, right. So far we can say that the COVID-19 vaccine is efficacy for the preventing the severe disease or symptomatic disease or even death. So when it comes to the asymptomatic symptoms, as we already discussed, that probably maybe 50 to 60% may not have any kind of sign of infection. So whether this vaccine prevents this asymptomatic infection is still under the investigation. some products may, but we don't know much about from the many of the products that currently we're using now. So actually, we still don't know whether this vaccine will prevent from transmission. So I think the bottom line, vaccine works for the symptomatic COVID-19 and severe disease and death, but we still need more data on the transmission.
Okay.
And then regarding
Durability.
to the duration, it's same. We still don't have much data on this durability or duration of the protection. So this is still under the investigation, and probably we'll find out maybe 1 year from now. We'll have a more sufficient data on this. And if we find out that the vaccine works for 10 years, then you don't need to get vaccinated every year. But if vaccine is only efficacy for like 6 months, then you may need the annual vaccination like a flu shot.
And I believe there's also some preliminary information on vaccine efficacy coming out from trials in Israel. And it does show the potential positive thing about preventing transmission in a real life setting. But I want to pose a question actually to Father Clarence. I'm sorry, we have got more of the ethical and theological questions towards the end of the forum. This part is more of the medical part. But let's say we find out that, let's say, the efficacy to prevent transmission is, if let's say the trials do come out in the region of like 3/4 or so, it would mean that, and some people may not even be able to be vaccinated for a variety of conditions, perhaps if they are young and it's not been tested on babies, for example. So is there even a Christian mandate to participate in vaccinations in order to protect those who, for example, can't, or those who are unable to? Father, you're muted.
Is there a Christian mandate? If you're asking me, is that one of the precepts of the 10 Commandments? It's certainly not there. You're talking about a time when, we never talk about vaccination. But I think if you look at it from a Christian mandate, the basic principle here is to protect life. And that is a given principle. That is a very fundamental principle in Christian theology, that you have a duty to protect life. And protect life, it doesn't mean just to protect your own self, but you also have a duty to protect your neighbor, your neighbor's life. So right. the question here is, whether we can compel people to go and be vaccinated. That's going to be a difficult thing to do, because you cannot compel anyone, and to mandate it or to say if there's a theological basis to compel people, there isn't one. But the principle of the common good is something that is very much ingrained in Christian theology, that it is not just my good, but the good of society.
Yes.
And I think that's something very important, because if you ask me for a biblical reference, is something like looking at the parable of the Good Samaritan, who cared for someone who was vulnerable,
right.
and I think that is something that one has to remember, that we may not have a Christian compulsion to be vaccinated, but I think there is a moral obligation to humanity that we should. And of course, if you choose or if you can't receive the vaccination for whatever reason, then there's also an obligation put on you to protect yourself and to protect others in whatever way, whatever form that you think. I think one of the things people are asking is, I see one of the questions, if I don't take the vaccination, is it okay if I just wore a mask? But the question is, are we disciplined enough to do that? I'm beginning to see with CMCO, people are kind of taking a step back and kind of very relaxed about putting masks on in different places, in public places. People, kind of like, they feel that they are protected. And also, I mean, all the readings that you see, people who have been vaccinated seem to think that they have this false sense of protection also.
Right.
So I think the principle here is not about compelling someone, but the principle here is the principle of common good. And the common good is to protect life, to protect my life, to protect the life of my neighbor. Because, I mean, human beings are not isolated. We are social beings. We tend to meet people. We tend to go to common places. You may not know, as they say, all the panelists are saying, you could be asymptomatic and you could be a vector in that sense. You could be passing it on to somebody else without knowing realizing it. So I think the good of society, the good of humanity, it kind of itself compels us to look at at the vaccination as the way of protecting life.
Yeah, if I may add on to what Father Clarence, I strongly agree with what he says, that it's not a mandate, but it's an imperative that we have to look after our neighbors. Okay, so who is our neighbor? So that means if we immunize, we know that there's such thing called herd immunity. So the more people get immunized, it does reduce the infection rate and even the severity of the infection. We have a lot of experience, a lot of data from measles immunization. Okay, that says that if a population get immunized, even those who didn't get immunized get a very milder form of infection. Okay, but to expand the scope of being neighbor, I want to consider that we should consider the poorer countries. Okay, Malaysia is lucky that there's enough vaccine for everybody, but the poorer countries are not getting the vaccine. Okay, so something that I think we should pick up on this later on in discussion.
Excellent. Now, time is limited, so I want to pose the next series of questions on eligibility, Prof. Adeeba. I think some of this information is possibly things that people can just get online, but nevertheless, it was asked. It will be information on who can and who can't take the vaccine. And several groups have been pointed out. Can the very old take it? Can those with comorbidities, and even the chat group, can they take it? We had questions like from Kluang about people who've got hypertension, diabetes, and heart problems. And then we had also questions from Sabah Sandakan about whether pregnant women and those who are lactating, can they take it? And if you've had COVID before, do you need 1 or 2 jabs? And who should not take the vaccine? So if you could just run us through those very quickly, I think that would be very appreciated.
Thanks, Rian. I think the one group that clearly should not take the mRNA vaccine are those who have a history of severe allergies. So people with past history of anaphylactic reactions or severe allergies should consider taking perhaps a kill virus vaccine. Yeah, so number one. Other than that, those groups that you mentioned, the elderly, those with comorbidities, particularly diabetics, heart disease, in fact, they should be the ones prioritized to have the vaccines, right? And there's no real contraindication. There's no contraindication. They're the ones who we should, make sure that they get vaccinated as soon as possible. Now, those with cancer also should be vaccinated, but obviously not during the immediate period during chemotherapy, and this is not just unique to the COVID-19 vaccine. You don't go around vaccinating someone 2 days after they've had chemotherapy, right? So these are normal vaccine etiquette, if you like. So those people with cancer, you should discuss with your oncologist as to the correct timing of your vaccine. Similarly, in patients with lupus and other rheumatologic disease who are taking this or being injected or taking drugs, the immunomodulators, some of the newer drugs, you also need to discuss with your doctors as to what would be the right time to get vaccinated. But there are no other contraindications. In terms of pregnancy and lactating, the reason why there's been such a huge controversy over this is because the original trials exclude patients who are pregnant or lactating. And again, this is not unique to the COVID-19 vaccine. Most clinical trials, whether it's for vaccines or for new medications, will exclude pregnant women and lactating women because of issues of liability, etc., etc. So because there was no clinical trials data in pregnant women and children, there was some hesitancy in terms of vaccinating this group of women. However, since the rollout in the US and the UK have also included pregnant women and lactating women, we know that it's safe in these ladies. But what needs to happen is the obstetrician will need to discuss with these pregnant women, particularly those who are at risk of getting disease, whether they should be vaccinated, and again, the timing of vaccination.
Thank you so much. Now we have moving into the more interesting questions, and a few people asked this. And let me just phrase the questions into two summary, and I want to pose it actually to all the forum panelists because it's been asked so many times, and I think it's one of the things where we may not get even standard answers from the book. And it's the question of choice, and there are two elements to it. Should COVID-19 vaccination be made mandatory or compulsory? And we've got questions even from Dr. Giloris from Pinampang. We've got a similar question from Peter from PJ Gospel Hall asking this question. And the next part of this question is whether it's made compulsory or not, but should people be allowed to have a choice of vaccine? So I want to hear from all four panelists. So don't feel like you need to take too long to answer it, but just what are your initial views? Should it be mandatory? Should people have a choice of type of vaccine? And Father Clarence, I would like you to answer this too, because I think there's the ethical element too. So feel free, whoever wants to go first.
Maybe
go ahead.
I just jump in before the medical experts come in. I think we are in a situation where choice is not going to be a consideration because of availability of vaccine. And who's going to get it. In terms of prioritizing, yes, we understand that, certain people need to be prioritized over others to get it first. But in terms of choice, in Christian tradition, in Christian circles, theological circles, they've been talking about, and I think this we will take up later, about, the testing period for the vaccines and how it was tested. And, there are some issues about pro-life issues that were dealt with. But given the situation that we are in, there isn't a choice, I would think. And I don't think that, we should be asking for, it's not like going to a restaurant and picking out on asking for the menu. Can I have the menu, please? I would like to choose which one I would like. And I don't think we are in that situation, given the widespread of the pandemic. We just have to take a vaccine in either way. To help protect ourselves and to protect others. Yeah, that's the short answer to this whole thing.
Any other panelists who wants to go first? Yuho, please, Dr. Yuho.
So for the mandatory issues, I can just give you the historical perspective. So when the vaccine was introduced initially, like in 1960s or 70s, actually the many countries choose the mandatory vaccination, so that the vaccine was mandatory for the good for the public health. But maybe in the 70s, 80s, there's many lawsuits against the vaccination because of the possible side effects or any adverse events following immunization was actually the target for the lawsuit. So the many governments switched to the individual choice of the vaccination. So since then, I think most of the governments choose to be the voluntary vaccination because of mostly the legal issues was in the past. So I think for making the mandatory, you have to have a very good reason for the public and also the acceptance of the public. So if the Malaysian people feel like it should be mandatory and is accepted, then I think the government can choose, but mostly up to the government.
Yeah, if I jump in here, I'm a
Please.
pediatrician, so I am a very strong advocate of vaccination, especially for children. Okay, I believe that all children should be vaccinated minimum against 11 type of illnesses before they are 2 years old. Okay, so I'm a strong advocate of immunization. Okay, but I still believe that the parents should have a choice. I don't believe in mandating and making it a law. I think that basically we are still human beings and should be given a choice. Okay, so that also applies to the COVID vaccine. Now, whether we can choose our vaccine, I guess in the ideal world, we should be able to allow to choose our vaccine. Okay, but in this pandemic situation where the number of vaccine available is not that much, and it's up to COVID or government to get the vaccine, I think we have to take whatever the government gives us.
Prof. Adeeba, you're muted.
No, I would agree with both Yuho and Dr. Alex and Father Clarence that, I never believe in mandatory anything, that we all should be given a choice. But it's important that we give people the right information and to encourage them. Once you make it mandatory, then it imposes the legal aspects of it, and then it gets very complicated. In terms of the choice of the vaccine, like we now in Malaysia have the Pfizer BioNTech vaccine, the Sinovac vaccine. Let me tell you, as someone who's trying to vaccinate, 6,000 staff at PPUM and UM, the process is complex enough. And like Father said, it's not like you're going to go into a restaurant and get asked, do you want fish or beef? I wish it was that. But it is, quite a complicated process from getting the stockpile of vaccine from Ministry of Health to the vaccination site and organizing the appointments, etc., etc. Can you imagine if we allow people to come in and say, can I have the Pfizer vaccine or can I have the Sinovac vaccine? Because it actually has to be individually kind of arranged for you, especially with the Pfizer vaccine, because it has to be taken from -70 to -20 to, being thawed, if you like. So that's one of the reasons that we can't, let you pick and choose, with the exception of those with, severe reactions. Yeah.
Thank you so much, Prof. Adeeba. Our next section is going to be on the ethical and theological considerations, but I would like to share some findings with you all. I know so many of you all participated in the survey that we did, and I just want to reflect back some of the findings before we move on to the ethical and theological considerations. A lot of you all asked, there are so many opinions from experts who contradict each other. How do we know what's the truth? Who is in authority? What is the church's responsibility? Should the church help by giving facts and encouraging vaccination, or should we be silent on the subject? So let me just show some of the findings from the survey that you all filled up, many of you all filled up. And this is to a question asked, which of the following information avenues do you think that your congregation find most trustworthy on COVID-19 vaccinations? The smaller the number, the more trustworthy, and the bigger the number, the less trustworthy. And guess which are the two sources of information most trusted by the and it's actually people who are represented in this chat group right now. It's the WHO with the highest ranking 2.3, followed by church leaders. So as we move on to this section of discussing ethical and theological considerations, I just want you all to reflect at the importance that you all play as church Christian leaders in influencing and telling and informing, giving facts, giving the honest truth, giving testimonies to your flock, if you like. And you all are way higher than any other news source, even more reliable, more trusted than mainstream media, more trusted than the government of Malaysia, and certainly more trusted than social media. So with this motivation, I want to go to Father Clarence and ask you this question. There are many narratives circulating around. For example, whether accepting vaccination is like accepting the mark of the beast or 666. How do we as church leaders counter these narratives, both specifically with this mark of beast question, but more generally? And I've heard this from many sources. And I think it's very important if you're able to give a good answer, a good theological, a good Bible-based answer as Christian leaders. So Father Clarence, if you don't mind starting us off, and then
Firstly, before I get into that, I'm quite consoled to see that people believe church leaders more than the government of Malaysia. So I think it's quite comforting to know that we are more credible than the government of Malaysia. So
and you are.
What's interesting, this whole idea, this narrative about the mark of the beast, which actually comes from the book of Revelation, chapter 13. It was written in a certain context, and I think we shouldn't take the Bible out of context. This story about the mark of the beast has been, in circulation, not just for the COVID pandemic, but so many different ways. But more so now because of the availability of information and how information can be transmitted so quickly. People just keep forwarding all these narratives out there. I also saw something that some years ago, I remember, or many years ago, they said Ronald Reagan was the 666. To the world, simply because his name is Ronald Wilson Reagan. They all have 6 letters. So this narrative has been going around for quite a bit, and I don't think we should buy into this narrative, because the Bible was written at a particular time, and this was the context of Asia Minor that was written, and the mark of the beast was the Roman Empire that they were struggling with. So I think we shouldn't take the Bible out of context, and this probably is not. And there are so many other conspiracy theories out there, with regard to the vaccine. I also read people saying that, the vaccine will kind of somehow, deposit a microchip into your body, and then you'll be monitored everywhere, and I just keep telling people, they don't need to deposit a microchip to know where you are. The moment you turn on your phone in any country you land, you get a welcome message, and the country knows that you are there already. So they don't have to go to that extent. So I think the reality is that I think we really need to read the Bible, the context of the Bible, and not overgeneralize this whole narrative about this being the mark of the beast, the 666. And I think if we want to explain to our people, let's go back to the text, and what was the intention of the text when it was written? What was the political situation, the social situation of the text? And to understand that rather than overgeneralizing, because this has been going on for a long time, and people will keep saying the times of the genocide, they marked certain people as the 666. So this will not end, Wei-An, with this discussion. This 666 will keep coming back, and I keep saying that I was born in the year of 66. Thankfully, not in the month of June, because otherwise I would have been marked as the 666 in the church. So let's not overgeneralize and try to apply indiscriminately what the Bible actually intended.
Hopefully you're not born on the 16th of some other month as well, Brother Clarence. But on a more substantive ethical and theological question is on the use of cell lines from 2 aborted fetuses, one in 1973 and one in 1985, and the 2 cell lines related to this, one's HEK293 and the other is the PRC6. And these vaccines and these cell lines are not in the vaccine itself, but were used at some point in the development and production of not all the vaccines, but some of the vaccines. And I know the Vatican has issued a very informed, I read it and I really liked it, ethical position on this. And I just wondered if you would care to take some time to go through that with us.
Yeah, I think one has to remember that, yes, in the late 60s, early 70s, the human embryonic kidney was used to test some of these new vaccinations that were coming out. But I think based on the information that is available now, and this is to be verified by our experts here, based on the information that is available now, there were no new cell lines that were ordered or developed in that context, So what's around there are some kind of a connection with the original cell lines. So I think one thing is very clear from a Christian or from a Catholic tradition is that, yes, testing on embryos, aborted embryos is not accepted simply because it's life. Embryos are considered as human life, and life is sacred. And in that sense, the church does not promote that. But this whole cell line, okay, one thing I think we have to remember, there are no tissues directly in the vaccines. But in the preparatory stage, from what I read, is that it has been used in some way. But I think here lies the moral principle of what we call as the principle of cooperation, whether you have a direct cooperation in that evil act or not. And the way the Vatican has presented it is that, the principle of cooperation, there are two things. There's one, direct cooperation and indirect cooperation. I still remember, from the textbook explanation would be very simple explanation would be this. If someone performs an abortion, that's a direct cooperation. And if someone drives you to the clinic, that's indirect cooperation. So, that's a kind of like a simple explanation that people use. But in the context of here, in this development of vaccine, I think the Vatican has been very clear to say that we are talking about something 40 years later. And even though there may be a link to it, the indirect cooperation is far too remote to be able to make someone culpable to sin in this context. So it's too far. It's too far away. It's like, the other example that I use is like paying taxes. You pay taxes, but you do not know how the government uses your tax money, but you still pay taxes. Even though it may be used for uncharitable or things that you may not subscribe to. So in that sense, what the Vatican has said is that in a situation of a pandemic, it is permitted to use because there's a greater principle of protecting human life here. So there's a different principle that's at play here in terms of defending one's life and protecting the other person's life. So I think that's something that Christian leaders must talk about with their congregation, the ethical dimensions of the vaccine, and not just I think the medical explanations are quite clear, but people are conflicted in terms of their conscience. Whether should I take or should I not take? Is this part of God's will, or am I participating in an evil act? And I think this is where people need to be formed in the informed conscience. Ultimately, like all the panelists say, we cannot force people to take it, but I think it's our duty to form people's conscience, to understand that here lies a very important principle, the principle of protecting each other.
Thank you so much. I really appreciate that. I think it's really powerful to hear it from yourself. Yes, you can.
I think I agree with what Father Clarence says. And you have to realize that those fetal abortion, which is a legal abortion, by the way, was done about 40, 50 years ago. Okay, so what they did was they take a stem cell and start growing the cells. Okay, and these cell lines, there's only about 110 cell lines in the whole world. Okay, so these cell lines, if you give them the right nutrition, the cells will grow. So it's not a fetus that's growing. We are not reproducing the fetus. It's just a number of cells that are in the fetus that is keep growing. And these cell lines are actually immortal. If you give them the right nutrition, they can grow forever. Okay, so they do not make any of the virus out of the cell line. Okay, but because it's a human cell line, they test, it's a good culture medium, and they test the virus or the medication or the vaccine on it. Okay, so that means, in other words, they are not making the vaccine out of the cell line, but they test it. And a lot of the present vaccine that we're using, for example, rubella, chickenpox, are actually tested on this cell line. Okay, and a lot of drugs that we use, okay, are also tested on these cell lines. Because if we work in a human cell line, then it can work on human. So we are not talking about something new. That has been all along. Some of the medicine that you have been taking all this time has been using the cell line, but you don't know about it. It's only that now somebody highlighted it, and then it becomes an issue.
Thank you so much, Associate Professor Alex. We now move on to a special presentation by Yuho, Dr. Yuho, on just a couple of slides on really how to communicate risk. Before I hand it over to Dr. Yuho, I'm very well aware that we haven't answered a set of questions, both which came through the forms and which came through the chat. And I would just invite my panelists, if you could, to try and respond to these in the chat while Dr. Yuho presents. And let me just mention what these are. The questions are about the Sinovac versus the mRNA vaccine. And specifically for the mRNA vaccine, does it affect our genomes? This was asked by Vincent from PJ. Somebody even pointed out that even Kyrie has opted for Sinovac. So people want to know this, and I just encourage the panelists, if you could respond to some of these questions on the chat while Dr. Yuho types. We also have two other questions, which I think perhaps one for Dr. Alex, which is on children, noting that the vaccination rates for children is quite low. What's the context of that? And also herd immunity, if anybody wants to take this question, we need to aim for 80%. How are we going to do it? Since Malaysia has a large population who are not eligible currently for the vaccine because they're under age 18. Either if yourself, Dr. Alex or Prof. Adeeba, if you would be able to take these questions on the chat. I would just want to hand the floor now to Dr. Yuho. Over to you, Dr. Yuho, and I'll control the slides for you.
Thank you. So the WHO has a lot of tool for the communicating the general public, and I just brought some of the things that might be used for the religious leaders. So next slide, please. So the first question is why communication is important. So the vaccine do not work if it is not used. So the acceptance of the public is very important. So people need to have a vaccine confidence on, otherwise it's not used. So as the survey showed that I think the Christian leaders has a more trusted than the Malaysian government. So the leaders have key role in influencing the public. Next slide, please. So there's a three key message from the leaders. So when the one is vaccine safety and the compliance with the religious beliefs. And second one is the understanding of vaccine importance. And the third one is do not forget preventive practice. So next slide, please.
So sorry, technical problem. It's basically I got a new mouse and it's super sensitive and I just touched it and it just scrolled all the way to the end. I'm sorry, just give me 2 seconds. Nothing, the computer's still working. It didn't crash. Okay, I just need to share back. Sorry, Dr. Yuho.
No problem.
Okay. Will we the next slide?
Yeah, next slide.
This one?
So I wouldn't touch much about the religious belief, just about the vaccine safety. So as I said, the use trusted information source. This is a very, very important. And because the media tends to deliver the risks rather than benefits, so the media try to draw the attention. So there's a, they try to have like shocking news, like there's one people died after the vaccination, but those are most of the time is a coincidental event. So if you're giving the vaccination to the senior people, the natural death is kind of expected. And as during a discussion, we highlighted that the side effects are common, but most of them are transient and very minor and will go away. So the overall benefit in the vaccine outweigh the risks. Next, please. So second one is the importance of the vaccine. So the vaccine can prevent from your sickness and death of the COVID-19. So the leaders should help to promote vaccine uptake and confidence by assuring your community and explain the importance. So people get influenced by the behaviors or saying of trusted people. Next, please. So this is the last one. So vaccines do not assure the prevention of the COVID-19 transmission for now. We don't have good data for now. So you need to promote continued practice of key protect health behaviors and adherence to the SOPs, such as wearing a mask in the public, and physical distancing and hand hygiene. So even if you get vaccinated, you need to continue those for time being. And if we find more data that the vaccine will prevent transmission, then we may lift some of those SOPs. Thank you.
I want to open the floor to Father Clarence and also to Prof. Associate Prof. Alex, whether you would like to weigh on some advice on how us as church leaders we can communicate risk and communicate well with our congregants in a way to supplement what Yuho has shared with us.
I'm a strong advocate of forming the individual conscience in this context. There's something that I think we really cannot compel people in a situation like this. But if you form their conscience in terms of what even Alex was saying, that yes, there is a moral obligation or a moral imperative for us to care for our neighbor, to care for the one next to you, whoever that may be your immediate neighbor or someone somewhere else. I think this is what we need to communicate. I'm not too sure whether photo shoots are going to work very well. We're going to give confidence to people, get our leaders to get the vaccine and to put them up on Instagram and that people will follow. Of course, that's being done everywhere. Hoping that the visuals will instill confidence. I'm not too sure that's the way forward. But I think if as leaders we can tell people, I mean, we're not talking here about whether the vaccine is good or whether the vaccine is not good, whether it is going to have side effect or not. As church leaders, we may not have all the facts to provide for something like this. A conversation like this is very good. But to be able to help people to understand, the right and the duty to protect one another. So even if you choose not to, for whatever reason, you still have that imperative in you that's placed on you to protect somebody else. So you must take precautions, which means that not just mask, but all those things that have been said. You distance yourself from others. So the choice is there, whether you want it or not. But to see a higher principle, a higher value in all of this. Right. And I think the higher value here is the common good. And the common good is going to lead towards that herd immunity. So I think that's that's the narrative that I think church leaders should be speaking about. And let the medical experts deal with its efficacy, the side effects, etc., etc. If we can help people to look at that principle as a gospel principle, then people begin to form their thinking, and they begin to form. I think one of the things that we could help people is this, it's not that we have a shortage of information out there. It's the ability to discern which is the right information, and I think this is something that we can help people with forums like this for church leaders, help them to discern what is right, what is wrong. Otherwise, we just keep forwarding, everything and anything that we get. We don't help each other, especially in church WhatsApp groups. Every day we are sending people. Even before you read it, you forward it already. It's becoming an illness, I think, for many people. So I think if we can support one another and encourage one another and look at the gospel principles of life, of protecting human life, is something that. A narrative that I think church leaders should be advocating and encouraging among your little groups.
Dr. Alex, do you want to make some self?
Yeah, I agree totally with what Father Clarence says, and I also want to highlight the importance of community, the faith community. I think it's always done in context of the faith community, and secondly is that as leaders, we should be proactive rather than reactive. Okay, I believe that too long the church has been reactive. Okay, to be proactive means that we have to seek out information, and we actually have all the resources. Okay, you have online seminars like this. You have doctors in your congregation, your community, that you can actually seek out and get information, and then filter the information and then convey it to your congregation, because they listen to you, they respect you. So you must be proactive in finding the right information to convince them. That's why you're a leader, isn't it? You have to lead. No, you just can't hide in the with your head in the sand and say, oh, whatever happens, let it happen. So be proactive and filter information. Find the information, it's there. Okay, find the right information and share with people and make a decision as a community. Okay, that's my passion. So sorry.
Thank you so much. It's 4:29, and if you don't mind me, I know we're nearly more or less on time, but I just want to squeeze in a few more questions, which I think is interesting. And if you don't mind me doing so, especially Archbishop Julian, I hope you don't mind me if just a few minutes behind, but we're not very behind. I want to pose this question to Father Clarence, and I want to continue along the social justice issue, and noting that the pandemic has this K-shaped impact. You know, some households, the wealthier, for example, have actually increased their savings, while the worst off in society, some of them have come close to destitution. You know, and maybe some actually face destitution. You know, when we see the pictures of the refugees, the South American ones, especially, I remember seeing those pictures during the pandemic. So I just wanted your comments on what's the role of vaccination in socio-economic justice. Probably you've already said most of the points, but I just wanted to allow you to have more time on this.
Yeah, let me just start with a little story, and I think this story tells a lot. This is something that I observed, during the first lockdown. I just happened to go out to get some food, and I noticed this Grab food delivery guy on his motorbike. And I also noticed that, I live right in the city center, and I noticed a lot of people on the streets. More people have, have come out to the streets to get food. And there was this guy who was seated on the 5-foot way. This Grab rider has just delivered food. And he was going back, he rode past him. And what he did was he made a turn and came back and took out his wallet and gave this guy some money. I think this is a very powerful image of people caring for one another. And I thought to myself, probably the Grab rider has just been tipped and he didn't mind sharing what little he had with somebody else who was in a greater need. And I think this is what we are looking at, that we all need to reach out to help one another. And the whole story of what I come back to is the parable of the Good Samaritan. The whole question is, who is my neighbor? And everyone is a neighbor to each one of us. And I think this is where we need to step up. Those who have more, always to think that there's someone who has less. And someone who thinks he or she does not have enough, to think that there's someone who has even lesser than what you have. And I think this is something that we are able to do as a community. Of course, there are also things that policymakers, government should be doing to help others, to help the many people who have lost their jobs, to many people who have lost their livelihoods. And I think many churches have stepped up, and I know for a fact many churches have stepped up to help people, irrespective of who they are, whether church member or not church member, whether you have a particular religion or another religion. Churches have stepped up, and I think NGOs have stepped up to help. And I think this is something that must continue. And I keep saying that this word is so cliched now. You talk about the new normal. Everybody talks about new normal, but this is how God intended. If you go back to the Acts of the Apostles and you look at the early Christian community, what they did was they came together, they sold everything they had, and they shared with one another. They just shared their resources, and this is something that we as Christian leaders could talk about in terms of reaching out. Especially I think this has been highlighted, the migrants, the refugees, the undocumented ones who are so afraid to come out now to get some food wherever they may be, to be able to have our ears on the ground. And I think that's very important. So that's on our part in terms of justice. But I think on the part of policymakers also, I think as church leaders, we should also be demanding certain things. And I just want to reiterate what has already been said by the Catholic bishops, in terms of as demanding of policymakers would be, I think this has been already addressed, accurate information, and I think people need proper information to be given. They have a right to information, a right to efficacy and safety. But I think the other thing is the right to accessibility. Everyone should have access to the vaccine, especially the vulnerable, especially the poor. There shouldn't be a criteria who gets. I mean, of course, there are other issues. There's, we prioritize, but everyone should have access, and everyone should have the assurance that it will get to them. There shouldn't be any doubt. I mean, this is something a bit different, but I think as citizens, we also should be demanding accountability and transparency from policymakers. Accountability, because at a time like this, it is not to commercially exploit the situation, especially of pharmaceutical companies or anybody else who is managing this. It's not a time, because human misery is not a time to be exploited. And I think this is something that we should be asking. Church leaders should be reminding our people that, let's demand for accountability. Let's demand for transparency, how this is being procured, how it's being given out. I think we have a right to that information, and no one should be economically, financially benefiting from our misery at this time. And finally, I think it's the common good. Social justice has always been about the common good. Maybe not equal justice, but it's about equitable justice also. Those who need greater help will need more assistance than those who have better, like you say, those who are financially more stable may not need that extra help as compared to someone who has lost everything. Yeah, this is some of my key thoughts on social justice and the vaccination.
Thank you so much, Father Clarence. And I also want to just highlight, when you say about the good of many, there are people asking about how do we achieve herd immunity of 80%. We have a question from Kota Kinabalu by Dr. Jeffrey, since a large number of the people will be ineligible. And to me, if you don't mind me answering, even though I'm a moderator, I believe that some of the trials are being expanded to test the safety and efficacy in younger age groups and perhaps even in pregnant women. So I think hopefully if they do find it to be safe, then they can expand the eligibility to that population. But to me, the key point is it really highlights why it's so important for those who are eligible for vaccination to go ahead with what Father Clarence has been advocating for. Now, Prof. Adeeba, I hope you're still there, because I want to also link it to an even bigger question on HIV, where it's been one of these neglected diseases, and imagine if there was a vaccine for HIV, which there is not. And how do you feel about the fact that you've been working on this for decades, and there's no vaccine for HIV/AIDS, and then for a few months on COVID-19, and bingo, there's more than one efficacious vaccine. Why are there not many vaccines for these neglected diseases?
Right. So, you singled out HIV, but don't forget another disease that we commemorated yesterday, tuberculosis, which kills millions of people, thousands of people as well. We still don't have an effective vaccine for it. And the answer lies in I think two things. In the case of HIV, it's a much more complicated virus compared to the SARS coronavirus 2. Although there's been a lot of investment and resources and research into it, it is, it's compared to the coronavirus, it's a bit more complicated because of its retrovirus nature and the way interacts with the human cells, etc., etc. So that's one reason. But in the case of TB, I think and many other diseases that we need good vaccines for, it's simply because there's not been enough investment in it, and goes back to that first question that you asked, Alex. How come we've managed to come up with a vaccine in under 12 months? And one of the reasons is a lot of investment has gone into this. But then also, a lot of advances in science and research has got us here, the mRNA technology included. So, and one of the things I want to add in terms of the ability to get a vaccine out so quickly is for the first time, or almost for the first time in the world, that scientists work together in a really collaborative manner, shared the genome very early. Research platforms, global research platforms were made, and a good example would be the clinical trials research platform that enabled tens of thousands of results of patients be entered into, for instance, the Solidarity WHO trial. So there are all these innovations, I think, that we must learn from the COVID-19 pandemic and kind of reverse engineer it into the other diseases that have been neglected thus far.
Okay, we are drawing to a close, and I just want to give each of the panelists a chance to respond, to have a last word, and then I'll ask Archbishop Julian Lau to close us in prayer. Now, there are a couple of pending questions. Perhaps we didn't really discuss mRNA Sinovac except in the chat box. So feel free to touch on these if you want. But let me just ask each panelist in turn to have a last word, and then we'll ask Archbishop Julian Lau. And I do apologize due to the lack of time. We are unable to answer so many. There are so many interesting questions. I wish we had more time. Who would like to go first? Dr. Alex, would you like to start us off? Or
thank you.
with your last word?
Well, I'll never get the last word, but you never get any last words from me, but there's always plenty of words. Okay, I want to address 2 points. First is that the mRNA vaccine will never change our genome. Okay, first thing is that none of the mRNA vaccine is actually from the original virus. All these are artificially created, and they have been created so the mRNA doesn't enter into the cytoplasm, and then the cytoplasm doesn't enter into the nucleus. Okay, so it doesn't attach itself to our DNA. Okay, so that means there's no way the vaccine can change our genome. Okay, because it's all artificially created, and it's a RNA, not a DNA. So rest assured that we will not be mutated in any way. We will not have superpowers other than that,
right.
what we already have. Okay, that's 1 point. The second point is that I just want to leave the challenge with leaders when I say about proactive, is that with the vaccine, things may change in another way. Okay, but many of our members, okay, especially those in the higher income group, has spent 1 year at home. So instead of going on their yearly or twice daily overseas trip and all that, they will have a lot of money left over. They will save up a lot of money, and they're looking forward to going on a spending spree the moment the MCO is over. Why don't we give this money to the poor instead of going on a spending spree? That's something I will leave you with, and that's my last word. Thank you.
Thank you, Dr. Alex. Dr. Yuho?
Yes, first of all, thank you very much for the inviting WHO in this forum, and it was such a pleasure to discuss with the distinguished panelists together. And we know that this COVID-19 is not just impacting the health, but the society, economy, and whole. So for now, I think a vaccine is another tool. We still know that the social distancing, hand hygiene, and wearing a mask is very key to the overcome this COVID-19. So I think it's good news is the vaccine is coming, and hopefully maybe a year from now we can overcome this COVID-19, and we may not back to our normal life, but we can have more new normal, and I think WHO will update the guidance and all the SOPs, and will continue to support Malaysia as well. Thank you very much.
Thank you, Dr. Yuho and WHO, for being so supportive. Father Clarence, and then after that, Prof. Adeeba, and then we can close in prayer.
Yeah, thanks, Rian. Just 3 key points. I just like to conclude here. I think one thing what one has to remember that, you know, for every information that advocates a vaccination, there will be 10 other articles that will have a counter narrative. So there's no way of fighting this. You know, and I think that the question that perhaps we as Christians, those who are here and the Christian leaders, the question to ask is, what is our Christian duty in this situation? You know, what is my duty towards myself, my family, my neighbor? And I think that has to be the guiding principle. Otherwise, if we are fighting fact against fact, I don't think there'll be a winner at the end of this all for any one of us, because today we can flip-flop, and I always get in, even my own family, my own mother sometimes will ask me, hey, I read in the paper that, somebody who got the vaccination died. So that's, that seems to kind of stand out for everybody and not about how many other people who have been saved. So I think we ask ourselves, what is our Christian duty here? The second point I think this pandemic has pointed out is that maybe, I think God is asking, many people are asking, is this the sign of the end times? I wish I had a crystal ball to be able to say this is it or this is not. I don't have a crystal ball to say, but I think God has kind of like said, maybe it's time to reset our lives, to what he intended when he created all of us. How did God create all of us, and what was his intention for humanity? Some people asked, is this the Noah's flood, that God is wiping out, but biblically, after the flood, God said, no more like this, nothing like this. So really, we cannot say that, a God of love wants to punish humanity in this way. And I think perhaps it's time to maybe to realign our lives. And that is my hope, that as Christian leaders, we can preach this message that when we come back to some sense of normalcy, we are not going to go back to pre-pandemic, but, we are going to kind of reset our vision and to move as one humanity. And the last point is, the creation. And I think maybe this is something that we have not touched upon, but sometimes, because of humanity's neglect to care for creation, some of these things happen. Maybe a greater awareness of our role as Christian leaders to also talk about our role, our Christian duty to care for creation. Thank you very much.
Prof. Adeeba?
Thanks, Wean, for inviting me to be part of this panel. I hope we have managed to convince the Christian leaders who will go on to take this message to your congregation and to the public at large, because that survey that you did was very interesting, isn't it? You're together with WHO, the church leaders are the most trusted group of individuals. So you play a very important role, and you have quite a responsibility to the rest of us to share the facts and ensure that as many people will get vaccinated as possible. We know there's quite a significant number of people who are hesitant. We've only got 6 million people registered when we're aiming to get 26 or so. So we're still way off the mark, and that's only registered. We still have to put those needles in the arm. So hopefully, you will help us, the medical community, to convince the public and your congregation the need to vaccinate. Because believe me, as a person who's been looking after patients with COVID-19 for the last year, it is a terrible disease. Even for those who don't get severe disease, there are things like stigmatization and discrimination that people who get infected face with. And then, of course, like I mentioned earlier, there are a percentage of people who then end up with what's known as long COVID or post-acute COVID syndrome, with a whole host of symptoms and signs that we don't fully understand yet. So there are good vaccines now. Please ensure that you yourselves get vaccinated and encourage others to get vaccinated as well. Thank you.
Thank you.
Archbishop Julian Lau, I'm very impressed to see that not only do you have a face mask, I'm sure somewhere you also have a face shield at the back there, which is nicely not really hidden, but it's really a good example. I just want to thank everybody, and Archbishop, over to you for closing prayer. And before you don't sign off after the closing prayer with some feedback form.
Thank you, Wei An. Let us bow our heads in prayer. So, dear Heavenly Father, we are very grateful to you for, first and foremost, for the gift of doctors, researchers who have produced this vaccine in warp speed as a gift to the world, so that it will lessen the severe effects, the sickness, the death that has plagued this world of ours. We thank you, Lord, for the many medical staff, frontliners, who have worked so hard during this last 1 year to ensure the safety of all, especially the essential services workers that have put their lives on the line so that we will be able to function normally each day. And we also like to pray for the most vulnerable in our society, that they will not be forgotten in this vaccination program, especially the homeless, the migrants, the undocumented, the poor. And to us, the general public, I pray that the principles that were discussed today of caring for each other, for the common good, will be foremost in our minds as we register and as we step up to be vaccinated. And I'd like to also pray for all our religious leaders, especially our church leaders today, that we will encourage our flock to get vaccinated so that to protect self, we protect all, as the tagline of our government. Let us pray that we will all continue to adhere to the health protocols and that we will not forget that we are all part of this family, this human family. And let us not forget to practice charity to all. And dear friends, let us be reminded, and we ask that God will continue to guide each and every one of us, especially those in authority, that we do not forget, for all to be safe, every one of us have to be also safe. And so, dear Heavenly Father, we entrust this vaccination program unto your hands, and we pray that we as Christian leaders will take up the challenge to be examples, courageous examples for our congregation to follow. And may this program too be a success so that Malaysia too will be once again protected and healthy. And I ask Almighty God to keep all of us safe, to bless us, to bless Malaysia. Amen.
Thank you very much, Archbishop. And before y'all go, I just want to share a little quick feedback form QR code. Please do give us some feedback. I just want to thank once again all our excellent panelists for participating in this forum. I want to thank Archbishop also for the closing prayer. I want to thank all our co-conveners from CCM and the Archdiocese of Kuala Lumpur. I want to thank my my darling wife, who has been working very well behind the scenes in making this a success and telling me what to do. And I just want to thank everyone who has helped to disseminate this this event. We had really much more numbers than I expected, and it's really been encouraging. And I do want to apologize that we did not address all the questions asked. There were just too many, and we just do not have enough time. But do put in the feedback as an opportunity to add additional questions, and we could continue to interact this way. I think it's not going to be over in one session, but it's a continuous conversation on COVID-19 vaccination. So thank you once again, everybody. Please fill in the feedback form. Thank you to panelists. Thank you, everyone. I appreciate your time. Sorry for running a little bit over. Thank you very much.